With COVID-19 cases overwhelming Ontario's testing capacity, more people are turning to emergency departments, like this one in Oakville.
A lot of people coming in because they can't access the resources, but in addition, our numbers are going up. People are feeling a little bit disheartened by it, and I think it's overexhausting a lot of the systems.
But rules forcing healthcare workers to isolate if they've tested positive or been exposed to the virus are leaving fewer staff to respond.
We are noticing that it is depleting some of our staff in that capacity.
In Manitoba, 418 healthcare workers tested positive in 1 week. That's about 7 times more than the previous week. To prevent a collapse of the healthcare system, provinces are starting to loosen the rules. In Quebec, where 12,000 healthcare workers are at home, some who've tested positive will be allowed to stay on the job. Now, other provinces are reducing isolation periods.
We are also going to reduce the self-isolation period following a positive test, whether it's a PCR test or a rapid test, from 10 days down to 5 days.
To ensure sufficient staffing levels, workers have the opportunity to return to work after isolating for 7 days based on a negative PCR test on day 6 or 2 negative RAT tests at day 6 and 7.
American authorities reduced isolation periods this week, but the Public Health Agency of Canada says for now it's not changing its recommendation. And some in the healthcare system say any move that could increase contact between the contagious and the vulnerable should not be taken lightly.
I struggle to see where that's a good idea. And that would also mean someone showing up to work at Sobeys sick, someone that doesn't have a union to speak for them. I think that if you're sick, you should be able to stay home.
What's to stop us from just basically opening everything up and saying, hey, we don't need to isolate? Like, where do we draw the line here?
With pandemic conditions continually changing, finding the best response is still elusive. Ross Lord, Global News.